Hello. Lateral hip pain is a name given to pain on the outside of your hip or around the bony part of your outer thigh. The medical name is greater trochanteric pain syndrome. You may experience an aching or burning pain over the outside of your hip. This can sometimes move down your outer thigh towards your knee. You may also get pain in your buttock on the same side. The pain often gets worse during activities such as walking, running, or using stairs, or when sitting cross-legged or lying on that side at night. Lateral hip pain is usually caused by changes to the muscles in your bottom where they attach at your hip. This can happen due to repetitive movements or a sudden increase in activity, for example walking or running much further than usual. Sometimes, lateral hip pain can be caused by an injury like a fall or prolonged pressure to the area. It is important that you don't overwork your hip. We encourage you to stay active, but you should take regular breaks if you're out walking. Try to avoid resting your weight on one leg while standing. Instead, stand with your feet hip-width apart and try to distribute your weight evenly through both legs. Avoid sitting, standing, or lying with your legs crossed. If you get hip pain at night, try sleeping on your back. Alternatively, try sleeping on the opposite side with a pillow between your knees. Try not to spend too long doing any activity that worsens your hip pain. If these steps don't work, you may need to see a physiotherapist who can recommend a gradual strengthening program. This will include exercises which you should do every other day. This will allow the muscles to heal and become stronger. Here are some examples of the exercises they might recommend. Try to repeat every exercise up to 10 times. Lie flat on your back and squeeze your buttocks firmly together. Hold for around 3 seconds and relax. Now, slide your feet closer to your bottom by bending your knees. With your feet flat on the floor, squeeze your buttocks together and lift your bottom slowly off the floor. Try not to arch your back, but keep squeezing. Now gently relax back down to the floor. Next, lie flat on the floor, but with your painful hip against a wall. Keep your legs straight and push it sideways against the wall. Keep pushing for 3 to 5 seconds and then relax. Now stand up with your feet at least shoulder width apart. Bend your knees and hips as if you were going to sit down. Squat as low down as you can and stand back up again. Your pain may be slow to improve because it takes time for your muscles to strengthen. But be patient. Research has shown that you need to slowly increase the exercises over at least 6 weeks to reduce the pain in the long term. If you are struggling with the exercises, if your pain does not improve, or if your pain worsens, then you may need to see your GP or physiotherapist again.